Hi, I'm Dr. Jason Siegel, and welcome to Neuro Now. So one of the things I want to do with this channel is educate patients and educate viewers. And one of the ways I want to do that is by interviewing some of the national experts in different fields of neurology. I love learning about neurology. I think our patients and our viewers love learning about neurology. And I'm really excited about our first installment of this series. Today, I'm talking to Dr. Adam Rappoport, who is a specialist in sleep medicine and pediatric neurology. I've known Adam for many years. He's very highly respected in the field of pediatric sleep neurology. He's from the South Florida area originally. He did his undergraduate work at Ithaca College and University of Florida in Gainesville. I went to medical school at the University of Miami. He did his pediatrics residency through the University of Florida and his pediatric neurology residency through Mayo Clinic and Nemours Children's Clinic in Jacksonville, Florida. He then went up and did his sleep medicine fellowship at the University of Chicago. After fellowship in Chicago, he came back to Jacksonville. He is now on staff at Nemours Children's Clinic, where he is the director of clinical sleep medicine. I hope you're really excited to hear from Dr. Rappoport. I know I am. All right. I'm here with Dr. Rappoport. Hi, Adam. How are you doing?
I'm doing very well. Thanks for having me.
I'm really excited to have you here. We're going to put some interviews on our YouTube channel. We know so many people, so many experts. It'd be kind of a waste not to really learn from them. I love learning about neurology. I think a lot of people out there too. So, here this time of year, I think a lot of families are going through this big change and the kids going back to school, and I don't know about your family, but my family, one of the big struggles we have every year is adjusting to the sleep schedule, and the kids stay up later in the summertime and the sun's up, later, and there's not
Sure.
responsibilities the next day. Now we have to make this big transition. And at least for our family, it can be an interesting transition. Am I alone, or do you find that a lot of families have an issue with, or you have to go through a transition like that?
Feel like most families do, because you're right, because over the summertime, people kind of let loose a little bit. You're not as stringent with your sleep schedules or your routines, and you don't have to get up at a certain time. So kids often stay up late, watch movies, play games, hang out with their friends, and they sleep in too because they don't have any responsibilities first thing in the morning. So certainly there's a transition period, especially when school starts. It's really difficult at the first couple of days, if not weeks of school, to get them back into a rhythm, back into their routine, and get them back into their typical schedule that they normally have.
What are the consequences of not making that transition very well?
That's a good question. So if you don't transition well, you're going to end up with difficulty sleeping, essentially. I mean, because you're going to have more daytime symptoms, because if you are going to eventually get your child to get up and get ready for school and they're getting less sleep than they were getting over the entirety of the summer, they're going to be more difficult to get up. They might have some mood issues first thing in the morning. They'll be tired throughout the day. It can affect their mood, their behavior. It could even affect their academics. So it is a big problem. We'd like to get on top of it early on. And it is something that we often encounter in our neurology clinics.
When patients come to your clinic, what are the common symptoms that they might have? You already mentioned kind of mood, behavior, maybe academics. But if they're coming to see you, it might not have connected. Why is it that sometimes that might not connect with parents? Oh, obviously they're not getting enough, my kid's not getting enough sleep. What kind of things are parents worried about? What other things are you looking at in that kind of situation?
Yeah, so one of the more common things that we see is younger kids that have difficulty falling asleep or staying asleep. We know that young kids, I'm talking more so in the toddler range between 1 and 2, or even the preschool range up to 5 years old, they should be getting somewhere between, 10 and 14 hours of sleep, depending on their age. And when kids are sleep deprived, or they're not having, good quality of sleep, or they're not getting enough sleep, their symptoms manifest a little bit differently than you might think. So one of the most common mimickers of ADHD in terms of hyperactivity, inattentiveness, can all be related to poor sleep, whether it's not enough quality or quantity, like I was just saying. So we have a lot of kids that are hyperactive, they're inattentive, they're not sleepy, they're not necessarily tired, they're not cranky and groggy like we are as adults. Their symptoms present much more differently than ours do when we are not getting good quality or quantity of sleep. So that's one thing that we often encounter. The older kids, a lot of things that you'll see are things like we talked about before. Mood can change, behaviors can change, and they can outwardly express that they are sleepy, they're fatigued, they want to go to bed earlier, even though they don't. So it just kind of compounds on itself. Those are often the problems that we do see are the daytime symptoms, not necessarily the nighttime symptoms.
I think that's really interesting because yeah, you would think that even as you said, the toddlers, preschool age, what they should be sleepy. If they're not getting enough sleep, they should be sleepy and groggy like the rest of us. But they seem to have a almost opposite effect. That can I can see
Mhm.
where that could be really, I guess, surprising to a lot of parents.
Well, we talk about the assessment of things like ADHD. Most often, as a parent, you've heard of the Vanderbilt questionnaire. It's a questionnaire that you get. It's a questionnaire that you give to your teacher. You identify whether your child is hyperactive or inattentive, in which situation, and at home and at school. But nowhere on the questionnaire does it ask anything about sleep. We don't
Mm.
ask about how much sleep we get, if our sleep is of good quality. Do we have questions about sleep apnea? How much sleep do we get overall overnight? We don't know. We don't ask those questions. A lot of times we get children that come in and they're getting half the amount of sleep that they should be getting, or more than half the amount of sleep. And they are on medications like Adderall, Concerta, Vyvanse, all these stimulant medications that are used for ADHD when they're getting half of the required amount of sleep. So we often try to really promote good sleep habits, have them get enough sleep duration, and see if those symptoms can possibly get better.
You had mentioned 10 to 14 hours for younger kids, toddlers, preschoolers. How about grade school kids, middle schoolers, high schoolers?
In the 6 to 13-year age range, they should be getting 9 to 11 hours of sleep. Our teenagers up to about 17 years of age, 13, 14 up to 17, 18 years old, they should be getting closer to 8 to 10 hours of overnight sleep.
Yeah, and our oldest is 10. I'll tell you, he comes home from soccer practice sometimes as late as 9 o'clock, gets home, maybe has a snack, has to take a shower, still has to get up, 6:30 the next day. Um, how about, I think about the things like I just mentioned, he does before he goes to bed.
Mhm.
What kind of things do you see children do that may or may not be good to help them get to sleep?
Another great question. A lot of times, just in general, for most people, we suggest at least 1 to 2 hours before bedtime to start shutting everything down. Electronics, TV, movies, iPads, you name it, and kind of get into, the sleep routine. Whether you're a toddler or a teenager, you should have somewhat of a routine put together. Your child, yourself, you should know, dinner time, shower, bath time, pajamas, story time, whatever your actual bedtime routine is, there should be a routine. So anything that can interrupt that would cause difficulty falling asleep. A lot of this has to do with the environment that you're sleeping in. It could depend on the room that you're sleeping in. And a lot of this has to do with us as parents. How do we manage our children? Do we have difficulty getting them to follow our rules and the limits that we set for them? Do we provide them with the correct environment, routine, anything that can really help promote them getting good quality sleep and the ability to fall asleep, because a lot of the problem is with us as parents, especially depending on the age group. But those are things that I would say that can make it difficult. We definitely have kids, when we get a history, we find out that they're drinking soda at dinner, soda before bedtime. They're having snacks right before they eat. Some older kids are exercising right before bedtime. Those things can make it difficult to fall asleep.
Wow. Yes, once you have to start looking at yourself, that can be challenging, and I think a lot of parents, and you know this, we're busy. It's a busy lifestyle, and but yeah, I think you do a good job highlighting the importance of taking a step back from our busy lives, perhaps, and,
Yeah.
really at least examining the things that we're doing, not just with our kids, but ourselves too. I mean, I think this is you're a pediatric neurologist, but you've got fellowship trained in sleeping of all people of all ages, and I'm sure it's not something that's exclusive just to children. Where
Yeah,
can
sometimes we,
parents?
we, we
Oh,
think it's a problem just with our kids, but
mm,
especially the younger kids, most of their sleep routine is really dependent on how we set it up for them. right? I mean, if we just let them do whatever they want, whenever, I mean, we didn't want to go to sleep at our bedtime. I know I didn't want to go to sleep. You tell me when my
See,
bedtime is, I'm like, I want to watch another show. I want to
yeah,
hang out. I want to play more games. What are you guys doing out there? I have the same kind of questions, and I don't want to go to sleep. Even now, sometimes I don't want to
yeah.
go to bed at my bedtime. But at the same time, as parents, we do need to help our kids. We need to set limits. We need to provide them with the appropriate environment, and those are going to be the things that really helps them get better, more quality sleep.
Where can parents go for more information that they can look up on the internet?
The Moore's website actually has great resources in terms of sleep needs, sleep hygiene, and certain sleep disturbances as well. And if you wanted more information about specific sleep disorders, there's information on that as well.
The last question: if you had the #1 overall draft pick in a fantasy football league this year, who would you pick and why?
Jonathan Taylor's the number 1 pick right now.
Nice. Good old Colts boy. I like it. I like
Hey
it.
man, Michael Pittman. I like Michael
We'll see.
Pittman.
Okay,
I'm not
we'll
sure
see.
about Matt Ryan, but I like Michael Pittman. I like
Well,
Jonathan
somebody has to
Taylor.
throw to him, I guess.
Are you excited for this year?
Yeah, cautiously optimistic. Cautiously optimistic. Yeah.